Hello, everyone, and welcome to And Sleep, a whole youth social talk show series. My name is Tommy Licatese. For this multi-part series in which we discuss the lifestyles that can impact our sleep health, I have the pleasure of hosting cardiologist Dr. Patel. Today, we'll be discussing hypertension and sleep. Welcome to the program, Dr. Patel.
Thank you for having me.
Let's talk about hypertension. What's the prevalence of hypertension or high blood pressure here in the U.S.?
About 45% of adult population in USA has a diagnosis of hypertension or high blood pressure.
So what are the symptoms that you'll see in hypertensive patients?
Most of the time, patients are asymptomatic. They don't have any symptoms, and when they go to their doctor for routine visit, they found their blood pressure is elevated. Hypertension, along with diabetes, is the number one reason why people have a stroke, heart attack, kidney failure, aortic aneurysm, and other multiple diseases in the body.
Is there any correlation between sleep apnea and hypertension?
There is a clear correlation between sleep apnea and hypertension. And studies have also shown that when you treat sleep apnea, they are likely to respond better with medications.
What happens if their sleep apnea is left untreated for hypertensive patients?
When a sleep apnea is left untreated, there's a vicious cycle starts where patients' blood pressure goes high. Sleep apnea patients are more likely to gain weight, and the weight itself has deleterious effect on a blood pressure. Most of the patients with the sleep apnea are not aware of their condition. Their spouses are the one who comes to the doctor's office and they explain to doctors that he stops breathing or she stops breathing. That's where the workup starts for sleep apnea.
So what would you recommend to your patients who have both sleep apnea and high blood pressure? What's the treatment for them?
The first line therapy for people with the sleep apnea and hypertension is to reduce the weight, stop drinking excessive alcohol, stop taking some medications which affect the breathing at night. The second line of therapy is to get them a CPAP machine, which is not tolerated by about 50% of the patients. And the third and the latest in treatment line is to get them oral appliances, which is very well tolerated by most of the patients.
All right, well, great. Thank you for coming on to the show.
Thank you for having me.
All right.
Thank you.
Well, that completes this episode of And Sleep, a social talk show series with Dr. Patel. We encourage you to explore the rest of the episodes and visit wholeu.com to learn more about sleep breathing disorder treatment. The sleep professionals in this video series teamed up with WholeU to spread healthy sleep education across America and were paid for their appearances.